A startling reversal, RFK Jr.'s new stance on COVID-19 vaccines. On May 28, 2025, Health and Human Services Secretary Robert F. Kennedy Jr. announced a major shift in U.S. policy regarding COVID-19 vaccinations for healthy children and pregnant women. In a brief video, Kennedy declared that the CDC would no longer recommend COVID-19 vaccines for these groups. This move raised immediate questions about the rationale and process behind such a critical decision. The CDC has been the bedrock of evidence-based guidance, making this sudden change particularly concerning. Kennedy's past skepticism about vaccines adds another layer of complexity. The directive, dated May 19, 2025, instructs the CDC to remove COVID-19 vaccines from the recommended schedules for children and pregnant women. This abrupt policy shift leaves the public and scientific community grappling with its implications. As new viral threats emerge, robust and scientifically sound public health strategies remain crucial. The unveiling, a policy shift delivered via social media. Secretary Kennedy's video message was concise, but its implications were vast. He announced the removal of COVID-19 vaccines from the CDC's immunization schedule for these groups. Typically, changes to immunization schedules involve meticulous review and public dissemination of supporting data. The use of a short social media clip to announce such a profound policy alteration was jarring. The directive cited a lack of high-quality data on mRNA vaccine safety during pregnancy as the justification. However, this rationale has been met with skepticism by many in the obstetric and pediatric communities. Reports quickly surfaced suggesting that the CDC was not informed beforehand and was blindsided by Kennedy's video. This discrepancy created immediate confusion among healthcare providers and the public, undermining the clarity and authority usually associated with CDC guidance. Scientific community in disbelief, concerns over data and process. The reaction from the broader scientific and medical community to Secretary Kennedy's policy shift was swift and critical. Dr. Emily Smith from George Washington University stated, "Policy shouldn't be made through a one-minute video. No data was shared." Leading medical organizations expressed profound disappointment and grave concerns. The American College of Obstetricians and Gynecologists called the move extremely disappointing. They emphasized that vaccination remains a critical tool to mitigate risks during pregnancy. Similarly, the American Academy of Pediatrics was reportedly not consulted on this significant policy change affecting children. Pediatricians have consistently advocated for measures to protect children from infectious diseases. The argument that there is a lack of high-quality data on mRNA vaccine safety during pregnancy has been directly challenged by many experts. The looming shadow emergence of the NB.1.8.1 COVID variant. Compounding the concerns raised by Secretary Kennedy's policy shift is the rise of a new COVID-19 variant, NB.1.8.1. This variant is reportedly driving an increase in global COVID-19 activity. The World Health Organization reports global test positivity rates are at their highest point since July 2024. The NB.1.8.1 variant has already been detected within the United States. Early indications suggest it may possess enhanced transmissibility, weakening vaccine recommendations, while a new variant is gaining traction, appears counterintuitive to many infectious disease specialists. Navigating the fallout public health at a crossroads. The decision by HHS Secretary Robert F. Kennedy Jr. to alter COVID-19 vaccine policy places U.S. public health at a significant crossroads. One immediate consequence is the likely increase in vaccine hesitancy. For pregnant women, the removal of the vaccine recommendation could lead to an increase in severe COVID-19 cases during pregnancy. Obstetricians now face the challenging task of counseling patients amidst conflicting messages. The critical protection afforded to newborns through maternally derived antibodies will also be diminished. For healthy children, the policy shift may lead to lower vaccination rates, potentially resulting in more pediatric infections. The lack of consultation with the American Academy of Pediatrics further alienates the very experts dedicated to child welfare and health. The long-term impact on the nation's health and its trust in public health guidance remains a critical unfolding concern.